Good morning, well friends. I am your wellness social worker, Rolanda Brown Dennis, and welcome to the Wellness Social Worker Podcast, Untangled. Today, my lovely co-host is,
Honey, Rome, the agent of change. It's nice to see y'all again.
and we have a very special guest with us, Miss Chica, who is going to enlighten us with all the greatness that she provides and pouring into the community. And we are looking forward to learning as much as we possibly can from you. So I will pass the baton over to Miss Chica. Please introduce yourself. Tell us what you do and who you are. How do you define yourself? Who are you?
Well, first of all, thank you so much for having me on this podcast. I think it's just so important to have spaces where, as many spaces as possible, to talk about mental health and what we actually do. I think we get portrayed in a lot of different ways, social media and in the media. And so to actually have an opportunity to give the realities to what we do is very, very special. So thank you for having me on. Um, I am completely okay with you calling me Miss Chica, but I just want the viewers and listeners to know that if they Google Miss Chica, they might not find Miss Chica. I do go by Dr. Chica Hooper in all of my listings and all of that on the internet. But I am a licensed psychologist for the state of Florida. I have a private practice here in Tallahassee, Florida, where the practice right now is primarily focused on testing and evaluation services. So I specialize in providing ADHD, autism, general psychological evaluation services for children and adults. I do some other subspecialties like pre-employment psychological evaluations for public safety agencies. And I also provide parental fitness psychological evaluations for the Department of Children and Families. The part that I'm really starting to grow and step into for the practice is therapy services, because we need more evaluators, and maybe we'll probably get into that later. But at the end of the day, we also need people that treat, that provide intervention. And so I currently have hired 2 new therapists in the practice. And so we're really trying to expand that part. So it's a testing and therapy practice here in town.
Congratulations
Hey,
on that.
yeah,
That's
congrats.
awesome.
Thank
That's
you.
super awesome. So how did you get to where you are now? Like what made you decide to go down the path that you did? Was it like a childhood dream or what was the foundation?
Absolutely not a childhood dream, as a lot of my childhood dreams were very unrealistic. So I actually stumbled into the field, I would say. In high school, you take a lot of different electives, and kind of one of the cool electives to take was psychology. So I took an
Yeah.
elective psychology for a semester, right? Everyone's like, "Oh, it's going to be so interesting as the mind." So I was one of those kids. And then it was actually pretty intriguing for me. So I decided to take AP psychology. And so when it was time to graduate high school, the big question is, well, what are you going to major in? And really, the only thing I could fall back on that I found the slightest bit interesting was psychology. So I majored in psychology. When I was finishing my undergrad, if I'm honest, and I believe this podcast is about honesty,
It is. It is.
the reality is that you really can't do therapy at all with a bachelor's degree. And I had always said I wanted to get my master's. So I was like, well, naturally, I'm going to go get my master's in clinical mental health counseling, right? When I was finishing that degree, I started looking for a job. And again, in all honesty, the jobs that were within my skill level, I was quite shocked with how much the salaries were. And it
Hmm.
was not congruent with the lifestyle that I thought I was going to live.
Speak on it. Yes, ma'am. Tell
I'm
all that
honest.
truth.
I'm being honest. And so I had some thoughts like, how are we going to make this work? And
Yeah.
so I had decided that, I think I want to get my doctorate degree, my PhD. And at the time, I had a friend that was applying for PhD programs. And I had the privilege of hearing her talk through the application process. And then when she got in, and she was just giving me a lot of the ins. And when I started to really even think about it for myself, I realized that less than 2% of the treating field is African American or minorities, period. And so that's all minorities. So in terms of African American psychologists, I mean, it's less than one. And the thought of being part of something that was a unicorn in this
Yeah.
nation
Yeah.
really like struck a chord with me. It's like, I think this is where I need to be. There's not enough of us, and we know that we need support.
Yeah.
So that is my long-winded answer to how I got
No,
into the field and what initially, struck
that's
me.
that's that's beautiful. And I
Yeah.
want to like let's tap into that because so you just spoke about, the percentage, the population that are actual African American helpers, therapists, things of that nature. So since you've been in the field, like what has your experience been like when with working with your clients? Like are they receptive to it, or do you feel like they're a little more authentic
Apprehensive.
with themselves? Yeah.
My experience has been incredible. So when I finished my doctorate degree, the majority of my initial work was in college counseling centers. So I've been in predominantly white spaces in college counseling centers, and then I spent 5 years in the FAMU counseling center, HBCU experience. And I mean, I learned a lot from both. Being in a predominantly white institution, there's still Black and minority students that need support, probably
Yeah.
even more than when they're at
Yeah.
HBCUs, right? So it's been incredibly fulfilling and refreshing to be in a space where there's not many of us, and they see you and say, "Okay, I finally found my safe haven." As a professional in my practice, it's very I see everybody. African
Mm.
American, newly immigrated families, white families, very privileged high class families, politician families, people that are blue collar working families. Like I see everybody, and I love that. But with my minority folks, we have sometimes, not all, these types of conversations that I know for a fact that they're not going to have with any other professional, and they probably would not say if I were if I were not Black. Like there's some things that they say,
Mhm.
and I'm like, whoo, I
Mhm.
cringe. Like you probably shouldn't say that. But I can hold that for them, in my head. I can hold that for them, and I know what they mean, and I know the space, and I know why they're sharing that level of vulnerability with me. And so it's been just really, really, really great. I'm so happy that I'm in the space that I'm in.
That's amazing.
Yeah.
So when it comes to, because you were saying that with the minorities, you know that there's certain things that they're not going to say to other people, which one thing that we talk about a lot, especially in class, is the importance of cultural competency. So
Mhm.
how do you use that in the opposite way where you're in front of someone who isn't necessarily a part of the minority community, but you're still determined to, provide them the best possible service that they can get?
Sure. I So let me say that I strive to provide culturally competent service no matter who you are,
Mm.
right? I try to put things in a way that my politically oriented families would understand, my blue collar families would understand. I really try
Mhm.
to speak the language of who I'm talking to. When I say, like, sometimes people say things that they probably would not say to other people. Of course, I'm not going to give you examples because I wouldn't want to break confidentiality.
Of
But
course.
it's things that are like, it could be diagnoses, it could be like specific mental health symptoms that they've been experiencing for a long time but have never said anything out of shame and embarrassment.
Mm.
Um, it could be like discipline things that they have tried that if they said it in a school setting, the school may be ready to activate something. And let me preface that no one's ever told me something that's abusive that I needed to report, right?
Right.
But just things I just know that they would not openly talk about. Um, with most people.
Yeah, I agree. I, I I believe that I've experienced that as well with certain clients. It's almost like, when they see us, they see a safe space. They
Mhm.
see that they can like drop walls down and that there's like less judgment because it's like, okay, like you get me. There's
Mhm.
that level of comfort and you can just see it in their face, like,
Mm-hmm.
oh, it's like it melts away. And I know for me personally, it's a very rewarding feeling to actually see like that nonverbal, and it's
Mhm.
like, okay, we're gonna do this. We got this.
Right, right. And I think of myself as fairly young, and so I'm still up on pop culture, and I know some of the language, and when they use that language, I can use it right back, and just be in that space. And again, I think that's unique and special. Like you don't have to come in and have all the perfect vocabulary,
Right,
like 'cause I definitely know that my grammar and vocabulary can be off sometimes. So like I don't worry about stuff like that. I just need you to bring your full self to me so I can help
mm-hmm,
you better understand you and what recommendations I think are really going to help you
right,
where you're trying to go or
right,
where you want your child to thrive.
right. Did you ever, as you were beginning your journey in your career, did you ever feel like you encountered like imposter syndrome or anything like that?
Absolutely. Every day. Absolutely. I still sometimes wake up shocked that I'm running my own business. Like, we know in our, I don't know if you had this shared experience, but we do not talk about business sense in our classes at
Did I
all.
not?
At
Can
all.
I just say, I did not mean to cut you off, but I have had this conversation with Honey so many times, and
So
it
many
is
times.
it is my intention to teach my students about that because we talk about the clinical aspect of things, the macro aspect of things, you know, at the university level, and I think that this is just for all, universities, right? We always lead from like a client perspective, serving the client, which is great. It's not That's not a bad thing at all. However, once you cross that stage, what do you do? You know, there's no like it's great to go and do the trainings for the different modalities and things like that, but when you're looking at having your own private practice or being an independent consultant and things like that, nobody talks about the business aspect of it, like the amount of money that goes into preparing to have an office. You are absolutely right. I'm
No,
glad. Thank you for that
we don't
confirmation.
we don't get any foundation. You learn it vicariously,
Yeah,
or you have to go and pay for it, someone to tell you what you need to do
yeah.
each step of the way. And so part of my imposter syndrome that I've experienced is, man, do you really know what you're doing? Are you making proper business decisions? And yeah, what are you doing there? But the other part of my imposter syndrome is, can I really help people? Do I know
Yeah,
what I'm doing? Is that really what this client needs in terms of recommendations or needs to hear right now? Um,
right.
how do I sound? Do I sound like I know what I'm talking about? Hence why I don't like podcasts. Um, yeah, yeah. It's just all of those what if questions. And that the core foundation, I think, for most people in imposter syndrome, at least for myself, is, am I good enough?
Yeah,
Mm-hmm.
Am I
yeah.
worthy of this?
And you
So yeah,
are. And you
yeah.
are.
And I know that. I know that I'm clearly doing it. I
Yeah,
know
yeah.
that, but it's just that's what imposter syndrome is. It's always that, what if?
Yeah. That
What
little
if?
voice in the back. So
Yeah.
what do you do to um switch the mindset? Like when you recognize it's coming, like what do you do to put in place to be like, oh, let me shake out of this?
Yeah.
So there's probably a few things. What comes to mind right now is I remind myself that if someone else can do it, then it can be done. So I can do it too. You went to school, you have a degree, you know more than the average person. Even if you feel like you don't know nothing, you know more than the average person.
Yeah.
Um, I remind myself that if I've been doing it for 5 years in my practice, then I probably can do it for 5 more.
Yeah.
My bills are paid.
For sure.
Yeah.
Right now, God is so good. My schedule is full. People are
Amen.
referring. Yeah, people are referring to me. I have good Google reviews, even though it's only 2 reviews. So like I
But
try
we're
to,
gonna take
Two
those
out of
two
two is
and
still
express that
100%.
gratitude.
right. So I try to remind myself of all the things that are going right, because you can get really, really caught in the am I worthy? I don't think I'm worthy rabbit hole. And the issue with imposter syndrome is that it's kind of delusional, right? It's not a balanced view of looking at
Right.
a situation or yourself. And so I have to actively remind myself, but you're doing it,
Yeah.
and
Yeah.
you're doing it well.
Yeah.
You know?
Do you um I'm trying to think of how I want to say, like, I know what I want to say because now you got me like, oh my God, oh my God, oh my God. So when we're dealing with like that aspect of things, because that's huge when we're talking about like mentally, right? So we can look at things from like mental health for just, our community members that consist of therapists, as well, right? Because even though we know like we have the training and the skills and all of that, we still face some things. How much of societal views, social media, or the environments and groups that we're in, do you think play on the mental capacity of the imposter syndrome?
It's everything. It's everything. I think as no, I don't think I know. When I was providing therapy, one of my key interventions for my college students was to refrain from opening or even posting on social media for just 2 weeks or 3 weeks. We would set whatever goal, and we would go in a session and actively deactivate, delete social media.
Mm,
And we would check back in. How do you feel? What's
yeah,
happening? The anxiety, the stress went completely down,
yeah,
and the productivity and the goal direction skyrocketed. And again, I have a small sample, which is just college students that I worked with. So, who knows
yeah,
if they worked with anyone else. But I think it's everything. We are constantly, even if it's subconscious, it doesn't have to be very in your face. It's subconsciously, we're always comparing. How am I doing next to this other person?
right.
And it leads us to constantly feel like we're not enough. We're not doing
Yeah,
enough. Especially
yeah,
now we have grind culture, and we know that majority of the things we see on the internet is not real. It's only a highlight reel.
mm-hmm,
No one is posting,
Mhm.
well, very few people are posting depression and failure and I made that bad decision and I'm in debt. Very few people are posting their failures.
yeah,
Yeah.
But still we just get caught up in
yeah,
I want what they have.
yeah. Especially when
So,
you're looking at it from a business aspect of things also, because it seems as if in order to make your business thrive, like you have to be on social media like all the
yeah.
time. But like you said, they're not showing like the struggle. They're just showing like, okay, I've gotten what I want, the reward that comes at the end. They see the
Mhm.
start and then they see the finish, but they don't see like the journey
Yeah, I
that's
don't see the
within, so it doesn't make it realistic. So when we have others that are on this journey, or even if they're not starting a therapeutic practice, they can just be an entrepreneur or just trying to get, a job in whatever field that they're in. Like you said, they try to measure themselves compared to what they are seeing out there, and I honestly feel like it plays a huge role in the anxiety and depression aspect of things as well.
I
Yeah.
mean, it really distorts our view of the world and our
Mm,
view of ourselves. It's Social media is a wonderful tool for creating delusional thoughts about
yeah.
life,
That's
about
a
Yeah.
nice way to put it.
struggle. It's
Yeah.
And I heard on a different podcast recently that the internet is the place where nuance goes to die. So
Mm.
it'll make you think you can achieve everything without giving you all of the steps
Yeah.
and
Yeah.
hurdles. It's
Yeah.
where
Mm-hmm.
nuance goes to die. I mean, and I took that like personally. I'm like, yes, because my practice right now is filling up with people that swear they have ADHD and autism, and they don't have none of these things. And then I'm realizing that TikTok is trending right now for ADHD, autism, and dissociative identity disorder.
Yes.
And they're not talking about, the differences between
Mm-hmm.
anxiety, ADHD, like all these things, the
Yeah.
nuance that
Yeah.
separates human life, regular struggle from an actual disorder. Yeah, it's driving business, but it's really disturbing our community.
It's a
Yeah.
double-edged sword because on
It
one
is.
hand, everyone is getting more engaged with mental health. Everyone wants to know if they're dealing with something and figuring out how to combat it or like heal from it and get better. But you're automatically labeling yourself based off of characteristics that other people are saying that they have. And it's just like you
Mhm.
don't know what the DSM-5 says is required. And then you
Right.
may be, for example, as a Black, I'm African American. If I'm looking at a European American and they're saying this is their experience, my experience is going to be a little bit different. So
Mhm.
everyone's comparing how they experience their mental health to someone who's on a screen, but you don't know what life they lived compared to
Right.
the life that you're living. So everyone just thinks that they just have the same thing as everyone, which could probably be very damaging to your mental
Mhm.
health because if you feel
Mhm.
like you've had this diagnosis for your entire life but no one ever told you, you might start feeling like no one ever cares for you and you've been struggling all this time and no one ever noticed it. So on one hand, yeah, now we're going to therapy because we want to make sure we're okay, but for how long were you stewing in this thought process that you
Right.
were like this vulnerable person that never got cared for? Because how could everyone around me miss this one big glaring flashing
Mhm.
light of diagnosis of you have ADHD or you have autism? No one actually knows because no one's going to get the actual evaluation. It's like we're just evaluating each other and saying
Mhm.
this is what we have and just
Mhm.
accepting it.
Mm-hmm. And there's just the nuance. Like, to be honest, any and everyone can find themselves in the DSM. I mean, because most of those things are part of the human experience.
Yep.
Yeah.
But the internet will say that if you experience this one little thing, you have this condition. Well, what about the
Yeah.
nuance of the frequency, the intensity, the duration, the onset of certain symptoms? Do you even have enough of them? I mean, the internet doesn't capture that, as they shouldn't, because the internet is not a professional. But
Yeah.
yeah.
Yeah. Yeah. That's
So
wild.
I
Yeah.
did want to ask a question when we were talking about how no one ever tells you what it takes to start a business.
Hmm.
So and then there's the whole grind culture situation where you're just like you feel like you have to be working 48 hours in a
Hmm.
24-hour day. Somehow you manage to do that. Is there like a certain different level of intensity or like pressure that you feel with it being that you're not just opening a business, but you're trying to open a private practice to counsel other people? Like you feel like you have to go like make this happen faster so you can get to clients faster, or if something doesn't pan out, you feel like a higher sense of failure because you feel like it's not even just the business that's not following the steps you had planned, but now it's taking longer for you to reach out to people that need help. How do you
Yeah, I don't necessarily feel that way. That doesn't necessarily resonate with me because my clients are always going to be taken care of. If anything, it's the worry about, so I started this business, are my rates affordable for most, and will it help me to pay my bills? The client, I'm
Yeah.
going to see the clients,
Yeah.
and they're going to get treatment. But am I structuring my rates? How am I using my time to be the most efficient to generate the income? Um, and that, you know what, that is honestly not something you're going to get day one. You learn that from trial and error. Even business coaches, they're going to give you an idea of a work task flow, income flow. But the reality is that you have to find out what works for you. And you won't know
Mhm.
that until you're in this process. For me, I'm year 5, and this year has been about efficiency. The other 4 years was just about contracts and referrals and connections, so I can make sure, I have a steady flow. People know I'm out here. And this year has been efficiency. I'm doing it, but am I doing it the best way I can where I'm not going to burn out?
Right.
Yeah.
Right. That's good stuff. I'm over here like, oh my gosh. Yes, whew. Um I'm literally I'm processing everything that that you're saying, because you've hit on so many important topics. And I can see where it's not just directed at the professional, meaning the practitioner, but just the community members as well, that clients that we serve, or just your everyday person that works at Publix or Walmart or the gas station, or you know um things of that nature. And I guess from one of the big things, in addition to the business aspect, is because I try to get my students to understand the client population that they are stepping into when they are going into the community. So sometimes, when I ask them to identify, okay, like, which population would you like to work with? And they're like, oh, I want to work with kids, or I want to work with elders. Like, okay, what do you want to do? With it, because there's that's a population within itself, but there's little sub populations within that. And trying to bring to light just how societal norms and opinions and all of that, like, tie into it. And I can see on their faces at times where it's like, ma'am, you're mentally overwhelming us, right now. And so, what advice would you give to the upcoming practitioners, those that are on their journey? What advice would you give to them?
Yeah, there's so many things I wish I could say. But I think the primary thing, what hit for me was seeing people calling. Can you all hear me? Sorry.
Yes. Yes.
The primary thing that hit for me, what you just said is, who do you want to work with, right? It's, to be honest, I don't think anybody that's currently in their programs really for real, know who they want to work with. It is so cute to say, I want to work with kids. And the kids that you see that are in treatment, it can be very, very challenging, very
Right.
challenging. And so my biggest advice is to get experience, even in settings that you don't think will be interesting to you. That's one of the things I wish I had done more of. I think I told you all I've done mostly college counseling centers, but when I was on my internship at University of South Florida's counseling center, they allowed us to do a rotation in a health field, like a hospital, a VA hospital, or private practice, and there's some other options. And I was like, I'm really going to push myself. Let me go into the VA. Let me see what the VA is like. And I was in a primary care unit, and it was wonderful. It was an incredible experience. And I never really had an interest in military families or military individuals at all. But I was just so thrilled with the experience. I wish I had done more forensic work. I did one semester in my doctoral program with evaluations that end up in court. And that was interesting. Hence why I kind of do a little bit of it still now. I just think the biggest thing is to not be afraid to try things, because right now is the best time to try it. Because when you're a student or pre-licensed, you're under someone else's license. So if you mess up, it ain't really on you. It really isn't. This is time
I
to
agree.
try it, and it's not on you. Because when you get licensed, it's all on you, and you need to know what you're doing. And so don't be afraid to get out there and discover this was a poor match. I don't like this population. I don't like this type of work. I don't like this
Yeah.
type of setting,
Yeah.
you
I
know?
think
Yeah.
a lot of people, at least I can speak for my experience, and I think some of my colleagues in my like that's around my age and getting our licenses, there's like a certain level of guilt we feel with hopping around because of the notion where like how people say, oh, job hoppers, like you don't have any consistency, or you're just not, you're not determined enough to really settle in and just dig your nails in there and stay. But when you're doing because I'm doing what you're basically advising others to do. I've been hopping around and getting experiences, different places to kind of get a feel of what I really like. And I think that's probably been the most fulfilling part of my journey because I mean, you're aware that I did an internship at Appalachian Center because you helped
Right.
me decide that I wanted to do it there. And that was so nice for me because I was able to start out somewhere that was more comfortable because that's where I
Mhm.
assumed that I would like to go. I never thought that I would be going to substance abuse. I thought I would avoid that at all costs until I worked at this village, and that was the best job I ever had because I was learning new things and I was getting new experiences. And even when I realized it was time for me to leave, I still was able to leave with knowing that I helped people in a way that I probably never would have gotten a chance to do so if I didn't challenge myself to experience something that I didn't think that I might not be good at. So I think that's
Mhm.
great advice. A lot of people don't realize that this is the perfect time to jump around because a lot of us, because of grind culture, feel like we have to go out and
Mm-hmm.
immediately open our own private practice. That's the only way to make
Yeah.
money or to be the best social worker. And that's not true. But because of that mindset, that forces people to kind of try and tunnel vision focus on one demographic that they think they'll excel in and then just go straight towards that,
Mhm.
not knowing that if you jump around you can really figure out the best way to help people. And even if you don't stick to some of those demographics, you're now getting experience that you can just kind of combine with all the other experience that you got and help people even more because now you know that there's different things
They're
that people
doing.
require if they have different
Right.
experiences.
Right.
So I think it's important, like I said, the internet's where nuance goes to die. And so in this conversation, I think the nuances is important. When I say, get different experiences, I don't want to I'm not saying that I encourage people to jump around. I encourage people to really get their foot in a setting. This may mean like 6 months or longer, really get in there and then, determine if this is really what you want to do and then move on. I think how the intention around your moving around is important because what you don't want is by the time you become a professional and they're looking at your resume and they see that you've never stayed on a job longer than 3 months or 6 months, that does look not great. But if you can be intentional about, I am in a place of discovery of the demographic and the setting that really speaks to my skill set, and so I was
Right.
intentional about being in one setting for 6 months and the next settings for 6 months because I was on a journey. That sounds way better to an employer,
Mm-hmm.
rather than as I was just jumping around. You know what I
Yeah.
Yeah.
mean? People
Yeah.
want to hear, your intention. Um,
Mm-hmm.
in hiring, people want to know that you're going to stick around, even though they can't guarantee it. But I think it makes sense better for your journey and when you articulate it to, instead of saying jump, to say I was intentional about finding my best fit and my skill set. And by doing that, I learned, this amount of information about myself, about the clients that I have served. And now I have this well-informed generalist theoretical perspective on how I work with people.
Yeah.
Right.
Yeah. I agree with that. And to, kind of support, what you are saying. I I personally encourage, my students that even if you are in your internship and you identify something else, volunteer. You can go to a different agency and get some volunteer just to be able to fill your toolbox as much as possible. Because you're right, it doesn't it looks like, oh, you move from this to this to this. And I always tell my students, ideally I would like for you to remain in that placement through the entire matriculation of your
Right.
education.
Right.
However, I don't I don't want to put that stress and anxiety of like push through, even if aren't happy there, or you're seeing like this isn't my calling, like this, isn't, for me. And a way of helping them really identify, because you're absolutely right. They say that they want to work with kids, but it's not until they have that first field experience that they're really like, bam, in your face type of like, okay, is this really working? Because before that, it was lecture. It was lecture, it was
Right.
coursework, it was reading the books, the PowerPoints, all of that. And so in our minds, mentally, we have created this story and this vision of how
Yeah.
great we are. We got this big S on our chest, and we're like, we're here to save the world. And then we get into our placement, and I remind students that not everyone that's in that agency is a social worker, or whatever field that you're going into. So you have to learn how to navigate through that, and collaborate with others on your team,
Yeah.
and really find like, is this a good place? And it's like, okay, I don't know that I want to work in this capacity, with kids, or in this capacity, with the adults or with elders or what have
Right.
you. And it's like, all right, let's have an open discussion of what this really looks like. What do you want? Because it begins to get the wheels turning from there.
Right.
And I tell them, if you are at the placement and you feel like, I can learn a lot here, but this may not be where I want to take my career long term, let's volunteer. And if you are volunteering at different events, and doing things to help other agencies, we can still count that towards like your internship hours. So that way it makes them a little more open-minded. Yeah, because I
Yeah.
don't do the limiting beliefs at all.
Absolutely. I think that's like a perfect recommendation for the students. And I want to add, everyone wants to work with kids until they realize that they actually have to work with families. And no one really wants to
Exactly.
work with families. If you don't want to
Yes.
work with parents, then you can't work with kids.
Yes. Yes.
Because the parents, the children are usually
Yeah.
a manifestation of the
Yeah.
distress within the family unit. That's another thing. The other piece, there was something you had said. I come across this a lot with some of the practicum students I've had in the past in the practice, where they feel like if whatever they do, their internship or practicum experiences, that's what they have to do for the rest of their life. And that's not true.
Correct.
You want to be intentional about what you get your training in, but there's nothing that says that if I'm in a inpatient unit, when I graduate, I have to only apply to inpatient units. But no,
Yeah.
no. And most of us are going to change jobs 2 and 3 times before we find the one we're going to retire on.
Yeah.
The good thing
Yeah.
about being in the mental health field, we're in high demand, and you can
Yes.
literally do whatever you want.
Yes.
We want to do it competently.
Yes. Yes. No,
But
I'm with you on that one.
we can move around and get different experiences at any stage of our life.
Yeah. Yeah. Good stuff. Good
I
stuff.
wanted to add, and I don't know if you have a follow-up question. I wanted to add, going back to the original question about business, and we were talking about how we don't get this training in
Mhm.
our didactic work. And to be honest, I really feel like that's by design. This is a capitalist society, and the curriculum is built for us to go and work for someone else. And not
Mhm.
just to work for someone else, but to be underpaid and probably exploited for someone else. So we're not going to teach our students how to run their own businesses, knowing you can make 2 to 3 times more than if you work for that agency, because then who's that agency going to employ?
Exactly.
I
Right.
was
And so, go ahead.
No, I was saying I was
But
just talking about that
Oh,
with the
yeah.
clients at DISC yesterday, because we were going over cover letters, and I was like, okay, here are some, pro tips on when you're writing a cover letter or resume, have these certain keywords or look at these places so you can make sure that you're getting recognized for what you're capable of doing. And I told them, when it comes to capitalism, it's like a secret society where they only want to keep the people that they consider one of them within that world. So if
Right.
someone who they deem is below them is trying to elevate their life and get in that world, they're going to judge you based off of whether or not you know these little keywords or mannerisms or just things that they like places that they may go to that everyone in that world will congregate together, you wouldn't know about that because you weren't in that world. You're not born in it. You don't have the resources to know.
Right.
So
Right.
it's so easy to stay where we are because they are holding certain things that really show that you know what you're talking about and that you're
Right.
qualified to their definition. They keep that to themselves so that they stay within themselves. There's
Yeah.
no risk of anyone else coming in if you don't know the secret password.
Sure. The agency has to make money. I
Hmm.
mean, they can't work. I learned early on, you're not going to become rich working for someone else.
Hmm.
Mm.
Mm.
And not that
Mm.
my goal is to become rich, but like I'm not going to have the income I envisioned for myself when I came
Right.
into the field. I'm
Right. We're
not going
not
to
going to
have
shoot the
that.
possibility down.
Yeah, I'm not going to have that working for someone else, at least at this stage, maybe at the end, but not at
Mm.
this stage. And I'm like, well, but why not now? Why not now?
Yeah.
And
Yeah.
even if they can give me what I want in terms of where I'm trying to go with my own personal income goals, at what expense,
Yeah.
you know, at
Yeah.
what expense? And so in private practice, I work how I want to, I see who I want to, I set my own rates. The flexibility is there. And I don't want anyone to take my words as in everyone go start a private practice tomorrow, because there's nuance in starting a practice. It's
Yes.
hard.
Yes.
It is hard. I'm just speaking to the some of the things that motivated me, but it is
Yeah.
hard. It is hard.
But I think that even 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 in your clarification of saying like, I'm not telling everyone to go start a private practice, just in general of looking at like what this looks like for you on a long-term basis. It doesn't have to be a private practice. It can be, something else where you are contracting with different agencies or
Yep.
nonprofits, things like that. Um, and I'm along with you, right? I would never tell anybody like, don't go work for blah 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 blah. Like, don't do that. But that is someone else's dream that you are helping fulfill. What
Mhm.
is what is your dream, and how are you going to pour into yourself and pour into your dream? Now, you can very well work for someone else, but then also work on your dream as well. You know what I mean?
Mhm.
And be able to
Mhm.
have like that flexibility. Um, and
Mhm.
I and one thing that I've seen from a mental aspect, right? And we're talking about mental health, is how overwhelming that concept can be for students, especially when we are like tapping on the spring semester's, door. For us, the majority of my students graduate in the spring, and it becomes realistic. Like, wait, I'm not going to be in college anymore,
Yeah.
because some of them, they start, of course, in undergrad, and they jump right into the master's level.
Mhm.
So that has been
Mhm.
the foundation, of their life. And so now that they're about to graduate, it's like, okay, what do I do with this? Like, what do I do now? Like, how do I go about, doing this? And the automatic thought is, oh, I need to go and work for someone else, or I have to fit within their scope. Like, like you were saying, honey, like
Mhm.
I have to fit in this way or speak this way or know this in order to be able to, slide in there and get the praise and the pizza party and, all the other stuff for the recognition, when I think it's important to introduce the business aspect and start having these open-minded conversations of, where do you see yourself in the next 5, 10, 15, 20 years? And
Mhm.
do you see yourself working for yourself, or, owning a practice, or owning, what have you? And what steps are you taking right now to prepare? Because you can start doing that while you're in the program.
You
I advise
can.
my students, you want to obtain your LCSW, your licensed clinical social worker, look at the trainings that you would want to take now. Map out how much that is going to cost you, because it's completely different when you get into your practice, or you're in community mental health, or you're working in a group practice, and now you want to obtain these trainings and they're $1,300.
Mhm.
You know,
Yep,
it's
that's the reality.
yeah, that's the
That's the
reality.
reality. You're gonna pay for
And
it.
Yeah. And now you're no longer a student. You're out here with the grown people bills, and how are you going to pay your mortgage and your car note and all this and do this training modality? I just feel that it's so important to really pull out the different avenues of the business side, of things and have that introduction. And I'm so glad that you touched on that because it's major.
It is.
It's
It is.
so
I think
major.
I think that for folks that are trying to, there is a way to do it, but folks that are graduating and think that private practice is something they want to do, you still need to get licensed, because a lot of the all of the contracts and insurance panels require you to be licensed. So it makes
Mhm.
sense to maybe go into an agency, build up your experience, take your exams, get your hours before you go into private practice. Because
Mhm.
that's going to be a major hurdle to your income. And so be thinking about it before you get your degree. Go into an agency or a private practice that's going to offer you supervision before you go out on your own. I mean, that's the best and most responsible way to do it. I do not advise students just graduating to go and start their own private practice.
Yeah.
And then you need benefits.
Yeah.
So if
Yeah.
you're not on your parents' insurance, or
Yeah.
if you can't afford to pay for your insurance and set up your own retirement accounts, at the outset, then you probably need to work for someone first while you're trying to get all of these, again, micro steps aligned
Yeah.
before you jump out here full time.
And that's a great way to learn the do's and don'ts as well.
You'll learn them don'ts really, really quick, quicker than them do's.
And then to really take away the lessons. I've always looked at the agencies that I've worked at. I've looked at it from a lesson perspective. Like what lesson am I supposed to take away from this? If I've had different program directors, supervisors, or what have you, like, okay, I like the way that they approach this, but then I don't really care for this. And allowing it to help me shape myself and the type of leader
Absolutely.
I would like to be, not
Absolutely.
only within practice but in community as well, because that plays a big part of it when we're out, doing community engagement and town halls and things like that, how you're representing yourself. I just told them what Wednesday, like, you are your brand, your name, you are your brand, without having to put a flyer on social media or anything like that. As you're walking through the community, your face, your name, your interaction, your tone, your texture, your words, all of that, like, you are your brand. And
Absolutely.
that can make or break you. So,
Absolutely. My name comes up in so many spaces before I even get to them.
yeah.
Absolutely. I just went through this whole website redesign. And before I had did the website myself, and I was very proud of it. But then I learned that my website was trash. But then I started thinking like, it might be trash. This is what my web designer had said and my marketing team had said. It might be trash, but I'm full. And
Mm.
I think that that was meaningful to me, at least for my imposter
Yeah.
syndrome, that
Yeah.
it's my brand and my name and my face that's bringing people in, not this marketing strategy. I mean, I'm
Right.
trying it because I think it's an important aspect of business. You do need to have a marketing strategy and team. But at the end of the day, it's
Yes.
my name, it's
Yeah.
my face that's driving people here.
Yeah. Yeah.
That's another part of how I beat back on imposter syndrome.
Yeah. Yeah.
Yeah.
Yeah. That's good.
Yeah.
That's
Because
really
people
good.
don't read also. Let me just put that out there. I can have the
They
most beautiful
don't.
website. They ain't reading that. They just see a picture that they like, or they see your availability or whatever, and that's what's gonna make them call. But
Yeah.
Yeah.
Yeah. Yeah. Well, I really, really like this has been really awesome, and I appreciate you holding space for us and
absolutely.
sharing your experience and your knowledge. Is there any like last words that you would like to say to the community before we conclude?
Let me think. Um, I don't have anything profound to say, I guess. I think what I would want the Tallahassee, Florida community to continue to do is to advocate for themselves and the people
Mm,
that they love. And when they know something is not right, not sitting on it last minute
right.
before we seek help. I think a lot of the things that I'm running into now is that so I do evaluations and parents are calling me, we've got to get my child in. They're failing classes or they're about to get kicked out of school. And I can't see anybody until January. And I'm thinking in
Yeah.
my head, how long has this been happening?
Yeah.
How long have
Yeah.
we been struggling at home and school? How long has this behavior been present? Um, you know, I could have at least told you what you needed to do
Yeah.
before you came in, so that some intervention is happening by the time you get to me. So I guess I would encourage the stigma to come on down and for us to be honest with ourselves, honest with our family members, and call and seek the treatment, seek the
Yeah.
professional, not the internet, Google, TikToks professional um, answers, but get like a real professional to take a look, give you what you ultimately need.
Yeah. That's that's beautiful. That's
Yeah.
that's beautiful. Yeah. Honey, did you have any last words or any last questions?
I was just gonna say before we go, if Chica could share the name of your business, where you can be found, and how the community can reach out to you if they just deem that they need some evaluation or any extra therapeutic services.
Absolutely. So the name of my practice is the Tallahassee Psychology Group. My website is tallahasseepsychgroup.com. If you just put in Dr. Chica Hooper, it's gonna pop up into Google. My number is 850-325-0415. My office is located, and it's only by appointment only, so you couldn't just pop up. But my office is centrally located in town, less than a mile from downtown. I'm right across from the Moon nightclub in town, if people are familiar with that. I do take insurances, only two though. I take most Aetna plans and Capital Health Plan. And of course, folks can pay out of pocket. Um, yeah, and I have two therapists that have immediate availability. They are 85 a session, and um, you could get in almost immediately, like as in next day. So
Okay.
Okay.
yeah, maybe in the future, if y'all have a need and talking about the types of evaluations I do, I think so much of our community is not informed about what autism actually is and what ADHD actually is. I do a lot of my work is around psychoeducation with my families. That
Ooh,
child is
yeah.
not just being shy. It's more
Yeah.
than being shy. My child is not a behavior, it's not just a behavioral issue. Um, there is an impulsivity and hyperactivity associated with the behavior.
Yeah.
So if there's a need, I would love to talk about that.
Sounds like a part two to me.
Could be, maybe.
Oh, okay. I'm with it. I'm with it. Well, that concludes this episode of the Wellness Social Worker Untangled podcast. And again, we thank you for holding space for us.
Absolutely. Thank you for having me.
And
It's been
we
wonderful.
look forward to seeing you on part two.
All right. Sounds good.
All right.